Hello everyone, I'm Dr. Anikita Chauhan, Consultant Obstetrician Gynecologist in KIMS Cuddles Kondapur, Hyderabad and Women Care Kondapur. So today we are going to talk about emergency contraceptive pills. So these pills are easily available in the market with the name of iPill or Unwanted 72 and many other brands. These are over the counter pills, that means you will not need prescription, it is easily available, you can directly go and buy them. So what are these? As the name suggests, emergency contraceptive pills. These should be reserved for emergency purpose only and or as a backup, but never make these as a regular contraceptive for you. Okay. Now let me tell you how to take this medication. Usually this medication is available with a strip of single tablet and you are supposed to take this within 72 hours of unprotected intercourse. But that does not mean you will delay as much as possible. You are supposed to take this medication as soon as possible after the unprotected intercourse. Sooner the better. You will get a better result if you take it immediately. Now, this medication has multiple side effects. Some are minor like nausea, vomiting, headaches. Some people can have breast tenderness or irregular periods after consuming this tablet. It could be limited to that particular cycle, or it can take up to 2 to 3 months for your periods to come back to normal and regular. So because of the side effects like nausea and vomiting, it is advisable to take this medication after food only because it can cause you acidity and can lead to vomiting. So if in case you vomit after taking the tablet, within 2 hours of taking this tablet, you need to repeat the dose. You have to take a second pill. Now, as all the contraceptive have some failure rate, even this has a failure rate of 10 to 15%. Taking more than 2 or more tablets are not going to help you. Only one tablet is required for unprotected intercourse within 72 hours. But yes, if there is another episode of unprotected intercourse after 72 hours, then you might have to repeat the tablet. Now let me explain how does this tablet works. So these emergency contraceptive pills are a tablet of a high dose progesterone. Okay, so what does this tablet do? This tablet will avoid egg release, that is ovulation, or delay the ovulation. It also forms thick mucus plug around the cervix to prevent entry of the sperms inside the uterus. Next comes, if the sperms have already entered the uterus, it will avoid fertilization. Fertilization is the meeting of egg with the sperm to form a baby or a embryo. Now, if the embryo is formed, then it also avoids implantation, that is attaching of that embryo to the uterine inner wall, that is endometrium. So, this process is known as implantation. So, it will avoid pregnancy at every level. First, preventing ovulation. Second, avoiding the entry of the sperm. Next, avoiding fertilization, and ultimately avoiding the implantation. Now, who should take this tablet? So, somebody who has a unprotected intercourse can take. Somebody whose regular contraceptive have failed. For example, if they are using a condom and the condom broke or is torn during the process, then yes, you can take this emergency contraceptive pill. And if you are on a regular contraceptive pills of 21 days and you miss 2 or more tablets, then in that particular month you might have to take this emergency contraceptive pill. Females using female diaphragm or cervical caps, and if they get displaced during the intercourse, then yes, you might have to take this emergency contraceptive pill. Now, who should not take this contraceptive pill? Somebody who is on a regular contraceptive pill, definitely you will not need. Somebody who is already pregnant, they should not take this pill, and somebody who is planning miscarriage or abortion. So always remember, this is not an abortion pill. If you're already pregnant, this will not do any good for you. You need to visit your doctor. Not an abortion pill. If you're already pregnant, this will not do any good for you. You need to visit your doctor. Not an abortion pill. If you're already pregnant, this will not do any good for you. You need to visit your doctor. Not a abortion pill. If you're already pregnant, this will not do any good for you. You need to visit your doctor. Not a abortion pill. If you're already pregnant, this will not do any good for you. You need to visit your doctor. Not a abortion pill. If you're already pregnant, this will not do any good for you. You need to visit your doctor. Not a abortion pill. If you're already pregnant, this will not do any good for you. You need to visit your doctor. Not a abortion pill. If you're already pregnant, this will not do any good for you. You need to visit your doctor. Not a abortion pill.